start. Get to know our feet a little bit. And then I know Zephyr's taught you guys some really good warm-up techniques. Towel says different things, feet are dry. It absorbs better. And it works in where oils won't. Stretching the Achilles, plantar surface. And here I'm spreading the arch in the ball of her foot. This way you can hear of adhesions. You can also, when you learn how, you'll be able to feel if there's any Morton's neuromas in there, which are little masses of nerves that usually gets between the joints, and they can be really painful. This technique works really nice for moving lymph, and you work the pressure depending on, like she's got nice healthy feet, no congestion. If someone's got edema, you'd want to work very light, barely touching, rather light.
What's edema?
Swelling, fluid retention. Get everything loose. And then stretching the Achilles again. This is a nice technique. I know you guys learned it in your warm-up for just getting the flush all warm. But you can also, as you're doing this and spreading anything out, it's a really good first assessment. You'll find knots, you'll find congestion, you'll find crackles, all kinds of things. A little rotation on the toes, loosen them up. And you're loosening them here at the metatarsal joints. So you want to hold it and not do it really fast. You can make people dizzy. Then I always use my towel when I do this, because since the toes are slick, if you're just putting traction on them, you can be like snapping off the end and pinching, and this way you have a good grip. So I hold the foot below the metatarsal, and I put my hand all the way down on the metatarsal, rotate it with a little bit of traction, move up to the next joint, rotate it, and then off the end. I'll just do this one without the towel.
And how much pressure are you giving?
Well, I'm giving a little more because I don't have the towel there and I don't want to slip, but really just enough to hold. You're not really trying to squeeze too hard. It's more the manipulation. There, we got a little crackle. See, so if I have the towel, I'd be able to hold on just a little bit better, use less pressure, still get the traction, but I don't have to worry about slipping. Then I also do some nice stretch work. So you take the toes, a little bit of traction on them. This gives a nice stretch between the metatarsal joints and all the fascia and ligaments and tendons between each of the toes. It's also works the pecs, all your pec reflexes. As I tend to find that my clients, when they get up, they're much more relaxed in their chest, open, their lungs are more open, their shoulders are farther back. I actually have clients who come in for body work that only have me work on their feet. So if I work on their muscles, it's through their feet.
Amazing.
Do a lot of flexing and bending to see what's going on. Then I incorporate other techniques that you guys haven't learned yet. Checking different joints, see how they're loose, see where they're sticking. You can often tell what kind of shoes people are wearing by which joints are binding up. Like clogs and sandals, you'll get a lot of tension in these muscles here, all through the thoracic region of the foot. And then a nice twist. Keep everything loose.
Do feet tend to tighten up back pretty quick?
You know, it depends on what shoes they're putting them in, how active they are, and how chronic the conditions in their body are. But every time you do it, it takes longer, and it's looser the next time. A little hole in it.
It's going there.
Yes. Spread your feet out, allows the structure and the tensile strength of your feet to work the way it was designed, allows all the bones to settle in. Different people, though, it's hard. You know, it takes time. Like any other muscle, you need to build your muscles up in your feet just as much as, say, your hands or your arms or anything else. And you have to watch for defects. People who have had poor shoes all their life, you're going to have things you have to work back into shape, like how our little toes are always smashed in. And if you have a structural issue that's a bone issue, it may never correct. So.
That's the foot I'm missing from me.
Yep. They're all aware of that?
No, not really. I mean, I told them about it, they haven't seen anything.
Zephyr's missing a tendon in this. She had her hand repaired.
You didn't show them it's a extensor tendon. Extend.
And you didn't have a peroneus tertiary either, did you?
No.
Now, is this one uncomfortable for you right here?
Yes.
Okay. I'm going to skip that one. Now, when I'm working on her tarsals here, I found her navicular was out just a little bit. So by gently holding her foot in this position, I've got my thumb supporting the cuboid and my hand wrap around the tarsals. It can ease that back into place. If it's out really hard, that's not in your scope of practice. So if it slides back in, or you can use visceral manipulation, which is basically you're working on the diaphragms between the joints and just gently letting everything slide back into place, and you'll learn. You're not teaching any of that in the class, are you? We'll skip that part then.
We would only do it as positional release or MFI.
Yeah. See, and I can hear her foot shift, little crackles and just movements, really small movements, and you'll feel it slide back in. She'll show you some positional release later in the year, and you'll kind of feel the same thing. And then a nice little chest pump. It's good for the lungs. It's also good for the lymph. Pumps her calf, gets all the lymph moving back up into her body. A nice plantar scrape. See, now that I've loosened up the muscles in her feet, I can hear, if you come close, you can hear the popping, things that have loosened up and started to move. Oh, excuse me, just a second.
Totally thought that was a cell phone.
There's no cell phones in the lab. You know that. Okay. And then I always check the solar plexus reflex point, but it's also K1. So I'll kind of check to see how balanced her energy is, how the flow through her feet goes. And then at the end I can compare and see what the difference is and how much relaxation she's achieved, how much balance.
You said K1.
Kidney 1.
Oh, thank you.
And we just start
Interesting, I
working.
can feel that in the corresponding
Points in your hand. Yeah. And as you're working on people, so thumb walk each of the zones. And I use, for Zephyr, she's in good shape. She doesn't have any chronic health issues, so I can use a fairly good pressure on this. If it was somebody with diabetes, a heart condition, deep vein thrombosis, my pressure would be more along these lines, where I'm just skimming the skin, or even not even barely touching it, working more energetically. Cancer patients, especially people who have been through a lot of chemo, if you work really lightly like this, same effect, they'll get just as much benefit, but it won't push the toxins through their body at quite the rate, so they won't have more detox. But it will cause everything to move through. Lighter work also keeps your hands longer. And some reflexologists, this is the kind of pressure they use all of the time. Others use pressure like this, where you're getting in, you're grinding to the bone, and you're moving. It's really working on a physical plane, real muscular. You can get into the tendons and different things. Not always comfortable for the client and really difficult on your hands. But Zephyr's in a good place, so we work with a moderate pressure.
You ask them what they want?
No, because people don't, especially people who have never had reflexology, won't know what you're talking about. And I let the feet guide the session and not the client, because they may be saying, I have, let's say I have GERDs, and I need you to work on my, they'll say, well, my diaphragm and my stomach and my esophagus. Well, that's really nice and fine, but just because they have GERDs doesn't mean it's the only thing that's going on. And you want to work the whole system. And you may find a reason why there's GERDs, like the diaphragm is really tight and pushing the stomach up. They may have traces of a hernia. Things that you can't diagnose, but you can find things on their feet that'll relate to that. And you can ask questions and look at the bigger picture. So you'll find things with their feet, that with tendons, with ligaments, with bones, have absolutely nothing to do with the girds, but have to do with their whole body system.
What's yours?
Acid reflux. And then I do all 5 zones on the feet, and then on the big toe I do all 5 zones. And then on the little toes, depending on how long a session it is and what I find going on, if it's a whole hour session, I'll do 3 to 5 zones on each toe. And the more passes you can make and the tinier bites you can make while you're thumb walking, the more reflex points you're hitting, the more nerves you're hitting. So I try to get about 25 to 30 bites on each pass of the toe, especially on the big toe. About 15 on the little toes. Little brain rub. Zephyr's getting much more sleep than she used to.
Why do you say that?
She used to work a lot. She used to be doing 2 classes at a time, and she hadn't had a break and wasn't getting a lot of sleep. She's got 2 children. I don't know. I'm sorry, Zephyr. I don't know if they knew that or not. I don't mean to divulge your personal. And any of you who are parents know you don't get a lot of sleep. She also works many more hours than just what you see her in class. And as I work the little toes, I work not just the back end. I start on one side and work my way around.
It feels incredible the way she takes little teeny tiny passes. I notice a lot of times when students start off, they'll jump around with these big random sweeping jumps, and it doesn't feel anything like these little tiny movements.
And I know a lot of people, when they learn, they also, you learn a routine, and you're going to vary a lot as you work on feet from the routine, but the routine is really nice to keep incorporated and work off of that, because it gives stability to your and also it gives a nice smooth. Every move transitions to another move. So there's no jumping around, no erratic here and there, and it's much more relaxing. And when I work, every toe is supported with the fingers behind it while I work on it with my thumb, or even with my hand behind it like that. So everything's always supported. She's never left hanging. There's never any of this, any moving around, nothing, no punching. That's so irritating when you're working on somebody's foot. And you work the spine up, and you'll see you're actually using kind of the corner of your thumb. Another reason why you want to keep your nails down. Those sharp corners can really poke. And I try to work like small bites up her. Work each, what would be each vertebrae. Find the muscle spot, I can do a little massage.
And you use your other hand as counter pressure?
As support. I'm holding her foot backwards.
Mm-hmm.
This gives me a better access to her spinal line. It also supports her foot, so it's not wiggling around, it's not moving. And then if she's got anything going on where, say, her feet are abducted, plantar flexed, supinated, anything, you can line them up, and whenever you say their foot falls or anything, grab their calf, move their whole foot and knee. Otherwise, you're just twisting at the knee, and that can strain a lot of people's knees. So working up every little vertebrae, tiny, tiny bites. Is that tender in there, Zephyr?
Yes, but that's not intense or anything.
Okay.
It's mildly tender.
So here you're also working her spinal muscles, not just her spine. You're stimulating the nerves that are coming out between each vertebrae. You're working her rectus spinae muscles. Then I'll support it with my other hand and work it in the other direction. The more directions you can work in, the better you cover the reflex. Another good thing is holding. You can find a point, say there's something, a lot of energy going through there or no energy, tight muscle. Holding is a wonderful thing. Bringing attention to that spot. People who have a lot of going on, energetic stuff, their energy's low, they have different chronic issues, you'll find spots that you may hold 10, 15 minutes. Don't ever be worried that somebody's going to think you're not doing anything. Because holding that spot sometimes is all it needs. It doesn't need to be manipulated. It doesn't need pressure. It just needs attention.
What does it feel like to you when you said there's energy in the spot? What do you feel?
Sometimes it's cold. Sometimes it's like a prickly. Sometimes it just feels heavy. And it will not necessarily feel the same thing to me as it will to you or the person I'm working on. Like right here on Zephyr, she's got a nice, right above her solar plexus, not on but above, she's got a nice spot there. And it just, it just doesn't feel right. Sometimes that's the only explanation I can give, is that it just doesn't feel right.
Or when you're first starting out, you're not sure what you're feeling. Sometimes it'll just feel different than what's around it.
And a lot of times when I hold a spot, I'll hold both sides of the foot. Then you can get the energy flowing between your two fingers. Get it moving. And it'll open up everything all the way through. So if it's something deep inside, you may be feeling it on the surface, but it may be something deep inside. And you'll start to feel it. Sometimes it feels unwinding. Sometimes you'll just feel the temperature pick up, or just you'll feel something flowing through there that you didn't feel before. When you learn how to feel a therapeutic pulse, a lot of times you'll feel that pulse pull up. It'll get erratic, it'll get slow, it'll move around, and then it'll just calm down and get to be nice and stable. Work a thyroid. That's a good place to do just a kind of a pin and hold. Doesn't take a lot of pressure. Her pineal and hypothalamus. And her pituitary and her toes. Stimulating her endocrine systems. And whenever I do a pin and hold, I always get a little love afterwards, just because it feels nicer. How you like it. Your feet and pull it down. It'll expose that shoulder line much better. Grab into her shoulder. This is like into your glenohumeral joint you guys will learn about. Shoulder joint. Give it a little pull and traction. It'll stretch the ball of the foot out. Open up that shoulder. And then do a nice flex of the joints. You can't do this on your foot. You have to. I'll show you that. Also come down and do some finger work. And that's just a finger, really light pressure. This can be really tender on people. Zephyr, you're feeling pretty good in here, no pain? Pardon?
That's true.
Okay. So that's really light. If someone's got a lot of congestion, excuse me, it can be really tender. Congestion here, this can be really tender and painful, so be careful. I always like to hit the diaphragm before I do the lungs. work it. And you bend the foot over the diaphragm with your other hand. So basically your thumb's just kind of sliding along. And you're using your other hand for the work. Walk back the other way. Do some flexing. If you do that before you work the lungs, it does help open the lungs up better. And just work the lungs. This is also working her pecs, her rib cage. Her heart. It's also working around her sternum and her rib cage. Working her digestive system, all of her esophagus and her thorax. All over her thorax. And you know, actually the thorax, when you're working, as long as you're working all the way down here, this is getting her whole thorax, her rib cage, that whole system in here. Then you work like her duodenal, her larynx, everything from her throat down, all of her bronchial, everything that moves from the trachea into the bronchi. And then I also use pin and stretch techniques, which are not comfortable, but they're very good for stretching out those vertical tendons. Doing a lot of walking in your Vibrams?
Off and on. I've been slacking on my active toe in yoga now.
Then I do a quick pass all across what would be her abdominal region, all her organs, because you're going to go back and you're going to work those again. But we kind of get a pass, get everything flowing across her heel. Good place to use your knuckles, especially if people have really tough feet. And if the mat will let me.
I have a question for you. You use relatively gentle pressure compared to a lot of people, and it feels awesome and super effective. And for many, many, many years, it seems like a lot of clients will say deeper, deeper on the feet. How do you talk to clients about the benefits of not needing to wail on their feet?
Well, I explained too, when you don't work as deep, you do feel more. Because if you're putting a lot of pressure on, the only thing you're going to feel, you're going to push through that muscle, and you're going to feel the bone. And you'll feel bone and you'll feel some ligament, but you won't be able to feel what's going on with the rest of the tissue. So I explained to them that I'll use a moderate pressure, and then when I find something, a ligament, a tendon, or a muscle that I need to work deeper on, I'll use that pressure. But that I can work their systems much more effectively, and that they'll get better results with a lighter touch. And if they're still deeper, I'll say, well, I'll tell you what, let's give it a try my way on one foot, and we'll do it deep on the other foot. And when we get done, we'll see which one that which one you like better, which one you felt was more effective. And I'll say 95% of the time, they never ask me for deeper again. Now, if you ever take the ARCB, I don't know if she's still giving, the one lady who did our testing, you could not go deep enough. You felt like you were breaking her bones, and she's still going, can't you do deep work? Can't you do deep work? So then we'll do like a little sun ray on her heel, and I'll support. Just work. This works hips. It works her reproductive system. Works those nice lateral rotators.
Patty mentioned it earlier, but she does it so naturally she didn't really call it out this time. She purposely twists the leg all
Oh.
the way up, so I feel the stretch in my hip, but she's not just tweaking on my ankle.
Yeah.
And then it's actually opening up the fascia
All
on
the
my
way
whole leg and hip, and not just the foot.
Yeah, there's things I just do. I've been doing it so long. You forget, yeah. I'll work up her, work upwards. You'll feel right along. There's a tendon here going up behind her ankle.
Is that a good tendon to work if people have like plantar fasciitis?
No, this one is not a great one for plantar fasciitis. This is a peroneus tendon, and it comes down and it wraps around the foot, and it's good for pronation and abduction. But what we're working here is behind the tendon. You'll feel like a ditch, and that's a chronic hip area, low back pain. And this one you can work in both directions. The one on the medial side of her leg, only work upwards. That's where the veins are, and you don't want to be working down the valve system. I also do work all the way around the ankle. There's all these little tendons and or ligaments in here, holding it to her calcaneus and her tarsals. And then I can feel like if she's got clicking or biting in her ankle, some kind of adhesion, you can release those ligaments. And her ankle will relax into itself, move back into position, and a lot of times they'll never hear the clicking again. Good place to work all your meridian lines is across the retinacular band here. So you can release the retinacular bands, relax everything, and stimulate the meridians at the same time. You can step into those, rotate onto them, hold them. This also works the fallopian tubes in women, the seminal tubes in men. And you can see here she's got a couple little scars on her ankle. You can feel if they're bound up, and you can do some scar release work on them at the same time. Hers are in pretty good shape. Then I'll come, and you'll see when I go to the inside, I'll press her foot up and outwards and do the same kind of stretch along the inside of her leg. Another thing I'd mention is you'll notice I have the height I have on her feet. They're even with my chest area, so I can keep better posture. If you're down too low, you'll wind up doing a lot of this, a lot of twisting. If they're up too high, your shoulders are going to get sore. And then too, you'll see I'm also not just inching my finger along. I actually have my arm up, and I'm using my whole arm. And then working up the inside. In this area, especially on the inside, can be really tender, especially if people have inflammation in their bodies. So you want to use a lighter pressure. Not a good area to dig in. And then I'll support her heel and do like the sun ray across. This will hit the womb, hit the genitals. And your spleen, kidney, and liver, yeah.
Meridians. Switching back and forth on the system.
That's what they'll be learning after the shoulder girdle, isn't it? Or with the shoulder girdle?
So do you feel like your right hip is settling in a little bit?
Very much. I was just thinking about it.
It totally is tilting to the right. Like,
Yeah.
yeah, it's opening.
And
I just
partly,
feel
yeah,
that.
when I've got this, I've got that so it opens up.
Yeah.
This will work. This also helps relax her adductors in her
So it
thighs.
opens.
Exactly.
Open up her.
It's like a bowl now.
Yep. Even the way your hip flexors are sitting, it's just like,
Yeah. And this is her bladder that I'm working here. And you'll find people who wind up getting up quite a bit at night. A lot of times you'll feel that this is much puffier. Sometimes it'll be red. It'll have sometimes not normally an oatmeal consistency. That's usually if there's other things going on, different inflammations. But you'll find that to be puffy. When women are pregnant, you'll be able to tell throughout this area.
How's that?
There'll be a little like kidney looking, it'll start like a little bump. And usually if you, depending on who you talk to and which modality, depending on the foot it shows up greater on, it'll be a boy or a girl.
Really?
So,
And does it show up like within the first couple weeks?
the first couple weeks it's usually more of an energy feeling. You'll feel it more in the womb area, a little swelling, some tenderness maybe. When girls have their periods or have issues with their ovaries, you'll feel their ovary on the outside of the foot. It'll feel like a little hard walnut, just a tiny little bump. If they have fibrotic cysts and things, you'll feel little bumps. You'll feel it in their womb area. Guys with different stamina issues, we'll say, you'll feel different things there too. You'll feel on the outside if they have.
Do you say stamina issues?
Yes.
Okay, go on.
You'll feel a lack of energy. You'll see some darkness sometimes in here. Younger men who have a lot of testosterone and energy going on, it'll be red often. It'll have a more vibrant, energetic feel to it. Sometimes prickly. You'll when you've done it a while, you'll start to know. You'll see those kind of things. You'll be able to sometimes see tattoos on people's feet that they have on their body. So there'll be shadows or markings.
Wow.
And
Very interesting.
Very cool.
kidney issues you'll be able to see throughout this area. When you work on the adrenal glands and kidneys, you'll be able to feel right in here where the kidney spot, the kidney reflex is, not the kidney 1 meridian. It'll often feel like a kidney bean.
It's okay. So you just cut it out.
So then I go back and I'll work the stomach area, work the pancreas and liver. I have one. It's just huge though, and it actually does go across this foot and onto that foot. The pancreas is on both feet. The stomach is on both feet. Working them in different directions. Working across the liver. Working that in different directions. And when you work somebody's gallbladder, as you're working in here, that'll be another pinch and bite technique. You can often, if somebody's gallbladder is starting to get inflamed or like getting stones in it, oftentimes you can feel little gritty stones when you're working that.
Can you work them out?
They say you can't, but by working somebody's reflex points, you can help give them, you can't say you can do that
I understand.
because but
I understand.
in my practice, I have had people with gallstones who've had them dissolve.
And what about people who've had their gallbladder removed?
You can still feel it. You can still feel it. It's energetically still there. This works the outside of the rib cage, side of her foot, and it just